Hi there, it's Nadine again. I'm a respiratory therapist, and today we're going to look at module number 3, pulmonary fibrosis exacerbations. So if you seen the module number 2, I kind of alluded to what that this is a possible occurrence for somebody that has been diagnosed with pulmonary fibrosis, and that we often have action plans set up for those people on what to do in case you do have a flare or an exacerbation. So we'll go into that in a lot more depth in this module. So what causes a worsening or an acute worsening of symptoms? Commonly, it's triggers. So triggers are things that you're exposed to that make all of those symptoms that come along with fibrosis worse. So some of them include getting a respiratory infection, viral or bacterial, smoking or being exposed to secondhand smoke, strong odors like perfumes or cleaning products, smog in a city environment, exhaust, gas fumes, um, hot or cold weather conditions. So humidity or the really cold weather can affect the lungs, and even emotions like stress or anxiety can trigger things. So it's important for everyone to know what their triggers are because they aren't the same for everybody. And then certain ones are avoidable, certain ones are not. So learning how to kind of smartly navigate them if you know you're going to be around them, or to have a plan if you are exposed and are triggered, what to do. So basically, an acute exacerbation is a sudden worsening of symptoms accompanied by an abrupt decline in lung function. So caused by a trigger, a lung infection, a clot in the lung, a pneumothorax, cardiac issues, etc. The signs and symptoms of an exacerbation are basically a worsening of your normal symptoms. So that's why it's so important to know what your normal is and to always base your comparisons on your normal. So, your normal shortness of breath level, your normal cough. Generally, for PF, we know it's generally a dry cough. If all of a sudden you're coughing and it's a phlegmy, productive cough, that's usually a red flag. More fatigued than normal, if you have a fever. So all of these things are different from your normal. That's basically your red flag to say, uh-oh, what's going on? Am I in a flare-up? So we generally like to come up with an action plan in the case that you do come into an issue with a flare-up. So an action plan is a tool developed with a practitioner or your therapist to determine what your baseline symptoms are, how to tell if you're in an exacerbation, and then what steps you should take if you are having one. Um, Sometimes exacerbations can be treated with the corticosteroids, like I mentioned from module number 2. So that would be prednisone. Sometimes they're treated with antibiotics if the cause is thought to be bacterial. We could also add in or increase your oxygen, supplemental oxygen, and in worst cases, may need hospitalization, including mechanical ventilation of some sort. So help breathing from a machine. So if we look, this is a general action plan for pulmonary fibrosis. It's a 2-pager. And generally, action plans are kind of broken down into kind of a stoplight color-coded system where you've got your green, your yellow, and your red. So in the green section, which we see on the first page, there's questions involved, and it's personalized, remember. So we fill this out for everyone and tailor it to you. So for the green section, green means you're feeling well. It's a normal day. So when we're filling this out, we're thinking about our baseline symptoms. So I want you to fill out, I feel short of breath when and then on a normal day, fill out what would normally make you short of breath. Do you cough regularly? Yes or no? Okay. My actions when I'm in the green zone, basically avoid triggers, sleep and eat well, do your regular activities and exercises, and then specifically you can fill out what kind of or sorts of exercises you do. Make sure you get vaccinated or protect yourself as much as you can from any possible infections. And then the bottom part section there is your treatment. So if you're on any medications specifically for PF, including the antifibrotics or anything else. Okay. Then if we move to the second page, we get into the yellow section. So this is kind of a warning time where you're noticing a change in your breathing. So these are things to watch for. Changes in your cough. So again, if you don't cough regularly and now you're coughing, that's a change from your baseline. If your cough is a dry cough and now it's productive, that again is a change in your baseline. Changes to the mucus itself. So if you do have a productive cough and it's normally, thin and clear in color, and then one day you wake up and it's thick, it's yellow, that's another change in your baseline symptoms. Also, then you're also going to note, are you more short of breath than you're normal? So things that you are normally able to do with not much problem now are causing you some issues. So if this is the case and you're noticing some of these changes, what do you do? Okay, so first thing is we have notify your resource person. So tell somebody just so that they know in case something, if it were to, get worse and if really quickly. You're going to avoid things that make your symptoms worse, which are those triggers that we talked about. You're going to use your breathing, relaxation, and energy conservation techniques. Okay, so pursed lip breathing, deep breathing. You're going to take it easy. You're not going to do something crazy like go and rake the yard. You're going to let your body rest, listen to your body. Okay. Do not wait more than 48 hours after noticing that the symptoms worsening before you contact your healthcare provider. So if after 48 hours you're still having issues, you need to be seen. So this is when we move into the red section. So if in any situation, if you have any chest pain, any extreme shortness of breath, if you're confused or drowsy or not making sense, those are instances where I would call 911 or go to emergency right away. Don't fool around when it comes to that. And then at that point, again, you're still using your breathing techniques, pursed lip breathing, and having somebody with you during that time is important as well. So that's kind of the general thing. It's the most important thing is to know what the signs of it worsening are, because that yellow section, that 48 hours, that's the sweet spot. And not, I shouldn't say sweet spot, but it is this time, it's the most critical time basically to tell, okay, to notice the change and to act on it before it gets to the point where it's an emergency and we need to do, more extensive measures at the hospital. Okay. So that's essentially what an action plan is. So if you don't have one yet, talk to your respiratory therapist or your provider. about coming up with one, and have a copy for yourself that you can reference if you need to. And it's always a nice resource to have, and just to know what to look for and to know what to do in the case. There may be some more specific things that they add to your specific action plan, but that one was more of a very generalized one. But there may be some more specifics that your practitioner or respirologist would want to add in there as well. So if you have any questions, please speak to your therapist or your practitioner about those. Thank you for listening.